Have you ever looked at a teenager and thought, what is going on in that brain? I know I did this weekend. Well, it turns out a lot. Between massive brain changes, social pressure, hormones, and a world that never turns off, being a teen today is more intense than ever. I'm Dr. J. Rutland, and I'm joined today by Dr. Sayeh Beheshti, psychiatrist and founder of Beheshti Wellness Collective. On this episode of The Health Exchange, we're diving deep into teenage mental health, what's normal, what's not, and how to spot the difference. This is an episode every parent, including myself, needs to hear. Let's get into it. Dr. Beheshti, or you told me to call you Dr. B.
Mm-hmm.
You're a psychiatrist in the area. What led you to psychiatry and really the focus of children and teenagers?
Well, I went to medical school thinking I'm going to be a pediatrician. I just love children and I just want to work with them. Turned out pediatrics wasn't for me because I realized that what I really want to do is spend time with my clients. And medicine, what I felt in medical school, what I realized was that it doesn't give you enough time with clients. You know, you're in, you're out, you're in, you're out. You spend a lot of time diagnosing, running tests, and that wasn't what I had gone to med school for. And then I started psychiatry. And during the psychiatry rotation, I felt like, where have you been all my life? This is it. This is the fit for me.
That's wonderful. You know, it's interesting as you answer the question, and this is kind of impromptu question. I noticed you said the word client.
Mm-hmm.
You didn't say patient. Is that something that you do deliberately, or is that just something that evolved over time?
I actually go back and forth.
Yeah.
Sometimes I say patient, sometimes I say client. But in psychiatry, even in medical school and residency, we were told not to wear our white coats because we don't want to create a distance between ourselves and the client, and we don't want to intimidate them. We're in a position where we really need the client to open up and talk to us and feel close to us, and that's why we go with client to make it a little less formal.
So hearing you talk about why you went into psychiatry and your love of children, and we talked about this on the phone, is there a particular patient or client story that helps shape where you are right now?
In general, children respond to treatment so much faster than adults. They don't have what I call baggage, as much baggage as adults do. And also they just soak up the love and the care and the attention you give them. It's just fantastic to see. And I had this one kid, he was 11 when he came to us, and he was labeled as a bad kid by his school, by his team. He was told by teachers, you're a bad kid. And he came to us and he was the sweetest thing. And once I started working with him, I realized, goodness gracious, this kid cannot sit still. It was actually hilarious. And it was very clear he had pretty significant ADHD. So we started treating him, and it took a while to get the right treatment. But once his ADHD was under control, this kid just blossomed at school, blossomed in his soccer team, and it changed his life. And, all it took was the right diagnosis and the right treatment, and this kid did fantastic. And these are the things that get me up every morning and get me to work.
I can relate to that story more than you think. But I guess when you think about that story,
Mm-hmm.
is that how you apply kind of your skills to what you're doing every day? Like your philosophy is based on how the outcome of that 11-year-old, like just how did you get that 11-year-old to open up? How did you get him to realize and to talk to you? Because it requires a lot of, I've been to a psychiatrist before. It requires a lot of opening up, being vulnerable, talking about it. And, even treating teenagers with asthma, like it's hard to get them to like talk to you. What's your approach there?
I know what you're saying. Some kids, you ask them, how was your day? And they go, good. That's all you get from them.
Yeah.
Is that what you're talking about? Yeah. Presence, presence, presence. I cannot stress that enough. Kids, actually all human beings, but especially kids, they want to be seen. They just want to know that you care about them, that you're genuine. And that's one of the reasons I picked psychiatry is because it allows me the time to be present with the client, whether they are children or adults. It takes time. I'll tell you about an adult that came to me once. And the first 2 hours that I spent with this woman, she was curled up on my couch in a fetal position and did not say a word. And I just sat with her, and my presence was enough and my patience was enough for her to eventually open up. So it takes time and it takes patience and an attunement to the person who's sitting in front of you. So depending on what I sense as a need in the person, that's how I respond to them. And I meet them where they're at.
Did going into psychiatry make you, do you think it's made you a better parent when you were raising your children?
Gosh, it must have made me a worse parent. My kids say I ruined all movies for them because I sit and analyze every movie. But what's happened is a couple of things have happened. I actually raised my kids when I went through med school. My second child was born in med school.
Wow.
I know.
Wow. No, I mean, I thought that those individuals that did that in medical school, knowing my mom was a single mom, I was like, you guys are amazing. Like even with a spouse, I was just like, to be able to have a child and go through that.
Yeah, it was difficult. It was very difficult. And my daughters are now 29 and 22, and I have a great relationship with them. And I think being a psychiatrist really helped me be present with my own kids and be attuned to them and be non-judgmental. So it was very helpful. But I did ruin movies for them.
You think that your approach to raising them, because you said you had your first one in med school?
My second one.
You had your second one in med school. So
Yes.
you already had one
Yes.
when you started medical school?
Yes.
And then you had your second one in medical school. And then you're going to go through residency and you learn so much. Did you like say to yourself as a parent, oh man, I've been doing this wrong. I better do it this way. Like, did you change your strategy?
Yes. Yes. I remember we had this incredible attending who taught us a lot. And I went to him after one of his lectures, just the most brilliant psychiatrist I've ever met. And I talked to him about my daughter, and he said something that made a big difference to me. He said, parents get the worst of their children. How is your child outside? Does she have friends? How's she doing in school? And I was like, oh, she's fine. And he said, yeah. So you get the worst of her. And that tells me that she's comfortable with you enough to be herself. And that was very helpful to me. And it helped me not be as worried about my daughter and how she was behaving around me.
You know, it's interesting because when we talked, you told me about your extensive experience in Orange County, and you have had a practice during a really interesting time in society with the development of social media, the internet, and all of these things that these kids are now going through. How have you changed since the beginning of your career going through and looking at everything that's happened and evolved over that course of time?
Gosh, that's a loaded question. It's been difficult. The hardest part for me is keeping up. Kids are just changing on a daily basis. The phrases they use, it's hard for me to keep up. I've also had to really adjust my philosophies a lot. When I started in psychiatry, gender neutrality wasn't a thing or hadn't become common. So even in terms of my language, I've had to learn to refer to children as they, them. And that was difficult for me, especially with English being my second language. It's been difficult to make that adjustment. And over again, I have learned to be non-judgmental, be non-judgmental, be non-judgmental. And it's been quite a growth for me. I learn more from my patients than from anybody else.
when you look at mental health issues in kids and really even in adults, they are on the rise. Do you think that's because of the way we live, or do you think we're just more sensitive to screening?
I think mental health issues have been long-standing. And I think I'm not sure if mental health issues are on the rise or just the diagnoses are on the rise. It's hard for me to tell. Kids are on social media now and self-diagnosing. And, you know, it used to be that people would come to me and say, I'm not feeling right. What is going on with me? Now they come in and say, I have borderline personality disorder and I have PTSD and I have ADHD. And I say, okay, let's let's say hello first. It is, I think there's a lot going on with social media that's affecting how we look at mental health. And the positive side of that is that we have become that mental health is much less stigmatized. My concern at this point is that to some degree, it's become kind of cool to have a couple of mental health diagnoses amongst at least a subset of children. And that's concerning to me.
In your experience in a youth center where you used to practice a lot, you're telling me that over the course of the last, I don't know, 10 to 15 years, you've seen a rise in children coming to you saying, I have anxiety, I have depression, I have.
Yes. Oddly enough, it's not anxiety and depression.
What is it?
Anxiety and depression are not cool enough. It's something else. PTSD, personality disorders seem to be a lot. I have kids tell me they have autism. A lot of children tell me they want to be tested for autism. It's interesting.
Out of those kids that you do see that say, I have autism, how many of those kids are correct? What percentage would you say? Just ballpark. I know just ballpark. What do you think?
I think a good portion. Maybe more than 50%.
More than 50%?
Yes.
Are self-diagnosing and they're accurate in their diagnosis.
They're accurate in their diagnosis.
What's the most surprising story where a kid came in, told you I have X, and you were like, oh, come on. And then you went through it and you're like, whoa, I guess so. Is there a story that sticks out?
Yes. I had a kid who told me he has multiple personality disorder. And by the way, that's a sexy one too. So, and to a great extent, in the world of psychiatry, there are doctors who don't believe that that's even a real diagnosis. But I've seen it enough times. I mean, 3 or 4 times in my entire career. It's very rare. So, I may have actually been dismissive of him when he told me
How
that.
old was he when he told you?
I think he was 16 or 17.
Okay. Is he a Gemini? I'm just kidding. I'm a Gemini. So
Are you?
Yeah. Go ahead. I'm just kidding. Go ahead. Yeah.
So he was pretty good at hiding it. So he told me about it. But his personality, actually, I did not witness it for myself for about a year. And then once I started witnessing it, it all fell into place. And all the different puzzle pieces that I couldn't fit in this entire year of working with this kid who was really struggling, all of a sudden, after a year, the personalities started coming out, and it was remarkable.
How do you treat that? Is it just cognitive behavioral therapy? Is there Are you trying to shut one personality down? Like, I don't know the first thing about addressing that.
You and me both, because again, it's so rare.
Yeah.
How do you address it with this? And it really comes down to the person. With this child, the approach I took was all accepting. Whatever personality comes out, this is a safe space. One of his personalities was a 4-year-old who hid under, who wanted to build a fort and hide under it. So I sat on the ground with him under his fort and talked to him at that level. And it was just basically radical acceptance.
Thanks for sharing that story. It's actually really interesting hearing it, because what I hear from you is I hear a really personalized approach. I think that's how psychiatry is in general. I think it's better
Yes.
than most of the other specialties where we're trying to put everybody in a box, where you guys are actually going to the level of where the patient is and meeting them there and bringing them
Yes.
out if they need to come out, or staying in there and saying, hey, this is safe. This is okay for you.
Yes.
So when you are treating these kids, what I haven't heard you say a lot of is, it doesn't sound like to me that you're just reaching in the medicine cabinet a lot. It sounds like you are doing a lot of talk therapy. That's what I'm hearing. Is that your approach?
Yes. The only time I run to the medicine cabinet is in the presence of psychosis, which is when you're hearing things or seeing things that aren't there, or there's obvious delusional thinking. Then I really, really am a big advocate of treating psychosis right away, because psychosis can damage the brain over time. Schizophrenia used to be called dementia precox because 20 or 30 years of psychosis, by the time the schizophrenic patients were in their 40s and 50s, they were displaying signs of dementia. So I do run for the medicine cabinet. When I see psychosis, I treat it. With everything else, I like to get to know the patient, find out what's going on, and then treat it, because there's so much overlap between different diagnoses. Like, for example, bipolar disorder and ADHD can have a lot of symptoms in common. Depression and ADHD can have a lot of symptoms in common. Anxiety and depression have a lot of symptoms in common. So I want to know what I'm treating before I start treating it.
What's the difference between schizophrenia and psychosis?
Psychosis can happen under any condition. So, severe depression can cause psychosis. Lack of sleep can cause psychosis. A significant trauma can cause psychosis. Schizophrenia is the presence of psychosis that has lasted a good amount of time, like more than 6 months consistently, and that it's there even when other symptoms aren't there. So the primary symptom is hearing voices, seeing things, or delusional thinking, or paranoia.
I heard you say that there's a lot of different psychiatric diagnoses that have overlapping symptoms.
Yes.
And you mentioned anxiety, depression, ADHD. ADHD is common, right?
Yes.
I have it. I'll tell you my story in a
Me
second.
too.
Yeah. We talked about this on the
Yes.
phone. How important is it to address ADHD in children and diagnose them early?
It is pretty darn important. Like, I cannot stress this enough. Kids with ADHD feel inadequate. They feel less than. They know something's going on. They know something is off because they get targeted at school by their teachers. They do feel like the bad kid, you know? I'll tell you a personal story. My mom used to take me to her hairstylist when I was little. And every time I walked through that door, the hairstylist would look at me and just roll his eyes and go, ugh, not her again. Because I couldn't sit still in that chair to get my hair cut. And this was the dynamic I grew up with. I felt like I was this unwanted, undesirable kid because I couldn't sit still. So this affects kids' self-esteem. It is very common for children with ADHD to develop depression by the time they hit teenage years. And, in this world where we care a lot about academic success, the kids who have ADHD are at a disadvantage. It's not that they're lazy or they're not smart or whatever there is. It's that they literally cannot focus. My daughter, she has dyslexia as well as ADHD, but she could not copy her assignments from the board to her paper. So she was never doing her assignments. And this was a challenge and the teachers were not nice to her.
I feel like your daughter and you, like when one of the stories in our family that my mom likes to tell. My mom likes to tell this like 5-year-old story of me. I was in kindergarten, and I went to Catholic school my entire life, and you had to apply to this school, the Holy Spirit. And I was Catholic, and I go to Mrs. Palaki's classroom, and Mrs. Palaki is testing to see if you are ready to sit down at a desk and be in kindergarten.
Because you're 5 years
Because
old.
I'm 5 years old.
Mm-hmm.
And so my mom tells a story like this. She says, you went to Mrs. Palaki's class. You were looking at everything. You couldn't sit still. You were playing with all the toys. And she was asking you questions, and you got every question correct. Every question she asked you, you got correct. But when all was said and done, Mrs. Palaki looked at me and said, your son's not ready for kindergarten. He can't sit still. And my mom, who's very aggressive, I gotta have her on this one day. My mom said, not only is he ready for kindergarten, but he can play with all these toys, not even clearly paying attention to you, answer all of your questions correctly. He's more than ready for kindergarten, right? So I went through kindergarten. I did fine. I always did well in school. But I know that I couldn't sit still. But I go through school like this, and I can spend literally 20 minutes on something, and then I have to go do something else. 20 minutes, go do something else. Did fine in school. Did fine in high school. Did decent in college. Did fine, right?
Clearly, you're a doctor. Yeah.
Got into medical school. In medical school, second year of medical school, like it just got to be a little much, like just studying for everything. I didn't fail a course. I did fine. But I was just like, dude, I'm 24 or something. And I'm like, dude, I got it. I go to the counselor, and the counselor's like Caroline or Catherine. She's like, I think you have ADHD. I go to a psychologist's office, Dr. Kevin White at University of Iowa, where I went to medical school. I enter this room, and there's a bunch of 6-year-olds and me. I'm 24.
I love it.
Right? And I walk in this room, and you know that old like thing that they put in pediatric offices where you had like the little blocks and they went on this wire, red, yellow, green, whatever. Like I was playing with that with the 6-year-olds, right?
Yes,
I'm like,
of course.
What am I doing here? Like, what's going on? I go into Dr. Kevin White's office. He takes me through a battery of tests.
Mm-hmm.
Memory, recall, questions about childhood, like all kinds of things. We're finished. And he looks at me and he says, you know, it's pretty amazing that you are where you are. And I was like, what do you mean? He's like, you have ADD, ADHD, I didn't know there was a difference, dyslexia, and dysnomia. You have all these things. And I said, what? And he was like, the reason why you got this far is because your memory is insane.
Yeah.
He's like, what you can remember in a minute, in 5 minutes, is 99 percentile of everybody else in the world on this planet.
Mm-hmm.
He's like, that's why you're able to get here. I started taking medication for ADHD,
Mm-hmm.
and it was a night and day difference.
All of a sudden, the struggles are gone.
Gone.
Yes.
I could sit, I could study, I could sit for hours and read and comprehend and take all of this in. And it was like, I go to my mom and I'm like, Mom, did teachers ever tell you that I had ADD or ADHD growing up? She looked, my mom's an attorney, right? She looks at me and she goes, all the time.
Oh my God.
And I was like, what do you mean? She's like, all the time, but you were getting straight A's. I didn't give a shit. Like, you were fine. I wasn't putting you on any medication or anything. You didn't need any of it. And look at you. You're fine. Right?
You're fine.
And I'm just
Yeah.
like, and it's just like one of those things. And I heard this thing the other day preparing for this. And this psychiatrist said, oh, what did he say? He said, ADHD brains are different than normal brains. He's like, a normal brain is a brain of importance. Whatever's important takes priority, and that's what they do. He said, ADHD brains are different. They're brains of interest. Whatever interests them is what they're going to do.
I love that.
And I was like, he's correct, right? I was just like, Jesus. Like, it was just one of those things where I was just like, oh my God. And so when I hear you say, like, you need to diagnose these kids early, I'm like, yeah, because I didn't even know this. Apparently, people with ADHD, their life expectancy is 10 years less.
Yes. Because it's overwhelming. Because your brain is constantly flooded and you're exhausted. Do you remember being exhausted?
Yeah.
Yeah. Yeah, because at the end of the day, you have to work 10 times as hard as every other kid to get the same thing done because you're working on your homework and whatever, you hear something outside and it's over. Your homework is over.
And I don't like bringing up healthcare disparities all the time, but like hearing you say you have to work 10 times harder. So for me, the reason why I never brought it up to anybody when I was growing up was because being Black, my grandfather was always like, you got to work 10 times harder than the white kid next to you, just because like you're not going to get noticed. You're not going to get the job. You're not going to get X, Y, or Z. You have to work harder than them. So I just felt like it was normal. I just had to do that.
I get it. You didn't realize it was the ADHD. You thought, okay, yeah, I've been told this. Yeah.
Yeah. And it's just, when I think about brain development, was there something wrong in my brain as a teen? Like when you say ADHD, is there a brain development issue? Is there something in the brain that's just not activated or whatnot?
I would say it's just a brain difference. I don't think there's anything wrong. I think we just think differently. Yes, we have brains that go for whatever's in front of us. I do a lot of, I'm very much into conscious living, which is the idea of being present in the moment. And I think the ADHD brain is present in the moment. It's much harder for someone who goes for what is important to be present in the moment the way an ADHD person can be present in the moment. So in a lot of ways, I look at my ADHD as a gift, not as a disease, even though attention deficit hyperactivity disorder, that last D means disorder. But I really sometimes look at it as a gift. I don't think ADHD kids have something wrong with their brains, or adults. I think we're just different in our learning. And this is a world that's designed for not ADHD people. So we just need to figure out how to help a child achieve their potential with ADHD. And I also want to really emphasize that getting a kid diagnosed doesn't necessarily mean getting them on medications. Imagine if you knew you had ADHD, just how, and forget medication. Imagine that you just knew you had ADHD through elementary school, junior high, high school, how things would have been different. I mean, at least maybe you would have been able to get accommodations at school, have a different testing environment, have have IEP, things like that. You don't necessarily need to medicate a child with ADHD, but knowing they have ADHD opens the door for accommodations.
My accommodation was you're sitting in the back of the class next to nobody. You can't talk to anybody. You go get isolated. Why is Jamie in the back?
And what is that? That's shaming.
Yeah.
That's shaming, that's isolating, that's mistreatment of this child who's already struggling. Good for you, Jamie. Good for you. You kicked ass. It's impressive.
I think about it like you do, which is it was a positive thing. Because I can tell you, as a pulmonary critical care physician, when I was in the ICU all the time, I purposely wouldn't take my medicine because I know that I wouldn't be able to go here, go there, go there, go there, go there, do this, do that, do that. Like I couldn't do that if I was on my medication, because my medication totally makes me like, zen. Like, I got it. Like I can, like I'm like the Riddler, just taking in all that information. Like I can do that.
Yeah.
But if I'm on it and I'm in the ICU, I'm not nearly as effective because I'm taking my time and focus on this task. And I'm not listening to the nurse telling me about the other patient down the hallway that's crashing. So
we are masters of multitasking.
Exactly.
Yes.
Right. And it's like, even when my wife is like telling me something and she thinks I'm not listening because I'm doing something else, I'm totally listening. I can hear you. I know what you just said. And I'll look at her and be like, you said blah, 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 blah.
Yeah.
And she's like, oh, like, like
I have that experience all the time.
Right. Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. Here's this week's question. Are ADHD medications safe for my teen long-term? This is something that I think about having ADHD. When you look at the long-term consequences, first of all, we know the medications are safe. But here are the long-term consequences. 1, cardiovascular effects. Increases your heart rate, small increases in blood pressure. 2, appetite suppression. These medications do have the tendency to tell you not to eat and to tell you that you're not hungry. 3, mood instability. They may make you a little bit more excited. They may make you a little bit more anxious. 4, growth suppression. There are some indications that these medications lead to individuals being about 1 to 2 centimeters shorter when they reach their adult height. These are the types of long-term consequences that we may see in these ADHD medications. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Thanks again to BuzzRx. Look up your medications on buzzrx.com or the app to see how much you can save. For a teenager, so if you have a, 12-year-old, as a parent, what are the things that we should be looking for to kind of warn us that our kids may demonstrate traits? Because I know that ADHD is genetic. If I have it, there is way more likely that my kids are going to have it. What are the things I should look for?
That's a good question. What should a parent look for? And it's pretty age dependent. With little kids, it's exactly what you said. That 5-year-old story, that's exactly what a parent should look for, which is the kid can't sit still. And, you're doing things, but you're also paying attention. And that is classic ADHD. I also, daydreaming. So in girls, especially, a lot of times they don't have the H component, they don't have the hyperactivity component, and they never get diagnosed. But then when you talk to them and you say, do the teachers ever ask you or tell you, oh, she's always sitting in the back daydreaming? And the parents go, yeah, she's always daydreaming. And they're so frustrated with the child. And I go, well, that's the attention deficit. They're not paying attention. So that's one of the things, daydreaming. The other thing is not sitting still. I had this kid in my office. He was so cute. He just could not, he was literally crawling on my furniture. And at some point, he was standing on the armrest of my chair above me. And, you don't need any tests to tell you this
He's got ADHD. Yeah.
So parents, the challenge for the parents is however your child is acting is normal to you, right? You are trained to see your child exactly the way they are. So you don't see that this child that cannot, sit still and is climbing all the furniture is clearly ADHD. But you should really be attuned to that. And teachers will tell you. What did your mom say? Teachers always told her you had ADHD.
Yeah.
So teachers will tell you. Again, the kids that fly under the radar are the kids who are actually inattentive. The daydreamers, they don't get caught because, and fortunately societies are changing, but we still expect, well, hopefully not, but society still expects girls to be good girls. And the daydreamers kind of learn how to fly under the radar and not be detected. And they get missed a lot of times. And by the time they end up on my couch as teenagers, the primary symptom that I see is depression, actually.
Oh.
Yeah.
That scares me a little bit. Is that part, because I think, I mean, like you, I got daughters. And so I just kind of, I really, really worry about that in them.
So my advice to you as a parent is stop worrying. How old are they?
12 and 10.
12 and 10. Does worrying ever change anything? Does it ever help? Yeah. So when you're worried, just remind yourself, I'm attuned to my children. I spend time with my children. I'm present with my children. And if there's a need for help, I'll know it. The biggest advice I give is don't wait to get help. It's amazing to me when, when your child falls and they scrape their knee and they're bleeding, you take them to the doctor. But a lot of times when kids are starting to socially isolate, which is always a red flag, or they become super irritable, all of a sudden they're having fights, all of a sudden their friends don't want to talk to them anymore. Parents are like, "Oh yeah, my kid's going through a phase." And I say, "It's not a phase. It's a red flag. You got to get your child help. Just like you got help for that scraped knee, you got to get help for the change in behavior. Any sudden change in behavior, red flag. Any isolation, red flag. Irritability is normal in teens. You're 10 and 12 children.
Yeah.
Brace yourself.
Oh my gosh. I had a question for you, and like after you just said that, it just like went away from my brain. It's like gone, because now I'm just sitting here thinking like, God, she's so right. Because oh man, the weekend we just had is interesting. When I think about ADHD and that diagnosis, medically, obviously, I know how to treat it with medications, right? With medications that inhibit the reuptake of norepinephrine, epinephrine, all that. My question is, what can you do besides medication for that ADHD teenager or even a grown up? Like what are some of the strategies beyond medication?
Okay. So it is a tragedy to me that parents don't know how much schools have obligation to help your child if your child has special needs. So get tested. Get tested through the school. Testing is expensive, but if you ask your school in writing, it is their job to respond to you within, I think, 14 business days. It has to be in writing. If you go to your teacher and say, my kid needs testing, that goes nowhere. If you go to the office and say, my kid needs testing, it goes nowhere.
And this is any school, whether they're doing virtual school, online, any public school, whatever it is?
Any public school. Any public school. I believe even if your child is in private school, you might be able to ask the district for help.
Cool.
So ask the school for help. Ask for, at least in California, there's a 504 and an IEP. And you put it in writing. I have concerns about my kid. These are the reasons I need my kid tested. The schools, because they're understaffed, they push back. You get a doctor to write a note for you. I write these notes all the time to the school saying, no, I agree with the parents. This kid needs to be tested.
Okay.
So
kid gets tested, diagnosed with ADHD.
ADHD.
Yeah.
So what do? You ask for special accommodations at school. So again, these are all non-medication issues. For kids under 12, for kids ages 8 to 12, the first thing I want to try is Endeavor RX, which is a computer game that you get a script from your doctor, and then it is $100. You send $100 to Endeavor RX, and they send you an iPad. And the kid plays on the iPad for about 25 minutes a day. And it is a commitment. It's 25 minutes, and it's a game. And it trains the brain to focus more.
Oh, wow. Okay.
Yeah.
Endeavor RX.
Endeavor RX.
Okay.
I'm a big fan of it.
All right.
The other modes of treatment are CBT. So fortunately, yes, cognitive behavioral therapy. Fortunately, there's a lot of programs I see that do CBT treatment for ADHD. So therapy, general therapy, CBT, Endeavor RX. I cannot stress this enough. Routine, structure and routine. For those of us who have ADHD, we know we hate structure, but it is important. It's important for the child to get up the same time every day, have a routine. The reward systems. I'm a big fan of reward systems. When you do your homework, we get to read a book together. You need to remember, just like you said, what is your limit? 20, 25 minutes? Mm-hmm. 20 or 25 minutes of work followed by a break. You cannot expect your ADHD child to sit down and do homework for 2 hours.
Right.
So learn as much as you can as a parent how to deal with ADHD. There are good books. There are programs out there. Find out what's local in your area. However, and like you said, there are stimulants, but there are also non-stimulants. There's a couple of non-stimulant options you can try first if you get to medication.
Okay.
So I always try to do Endeavor RX for age appropriate kids and also CBT and therapy before we do medication.
Got it.
It's always important to me to treat comorbid issues. Like, for example, if a kid comes to me with ADHD and they also have depression, I'm like, we got to get this depression under control before we even start addressing the ADHD, because depression takes away your ability to pay attention. Anxiety takes away your ability to pay attention. So treat the comorbid disorders, structure, therapy, Endeavor RX if age appropriate. And if none of that works, then we start talking about medication. There's also the severity. If the kid is like with this kid who was being called a bad kid, come on, I wasn't wasting my time with therapy.
Right.
I put that kid on medication.
Right.
Yeah.
I get it. I've seen the kids, right? And I get these questions all the time just because, I'm the doctor in the friend group. So I do see medications help kids significantly.
Yes.
But I also think, these days, parents are always nervous about medication, which I understand. I get it. And so they always want to have alternative therapies. And I think that those therapies work. I mean, one of the things that I did, I remember now, one of the things that I did is I would tire myself out. I would do my homework after basketball practice. I would do my homework after soccer practice because I knew when I could sit down and actually focus and complete the task. Right. And so that's one of the things I tell like my kids, if I think that they're displaying those kind of symptoms, and there are times where I think so, I'm like, okay, go to practice, come home, do your work.
Thanks for mentioning that. I forgot to mention exercise is huge. Yes, absolutely. Keep your kids active. ADHD and in general, keep your kids active.
All right, it's time for the lightning round. You guys know what the lightning round is. I'm going to say some statements. Dr. B is going to say true or false and explain. First statement: teens are just dramatic. It's a phase.
Well, teens are dramatic, but it's not a phase. Anything that causes conflict in the home is more than just drama. So that is a myth. And teens are just dramatic is a myth. If you're having issues, talk to the teacher, talk to the doctor, talk to professionals.
Statement number 2: if my teen is doing well in school, they're mentally healthy.
Absolutely false. Kids actually may be doing well in school as a coping mechanism. For example, they're depressed, but they just pour everything they have into their homework and don't address the issue. So overachieving is actually quite often a sign of anxiety or depression.
One of the things I heard from one of my parent friends was girls don't get ADHD. That's just a boy issue.
I don't know where that comes from, but the incidence of ADHD is the same in boys and girls.
And then another common thing, and we didn't talk about this, but I'll ask you in a moment. ADHD is overdiagnosed.
Yes, I hear that. I hear people say that. I don't know where that comes from. ADHD is not overdiagnosed. If anything, it may be underdiagnosed.
Another one, and this is something I was trained on at Iowa, talking about suicide or self-harm plants the idea in people.
That is absolutely false. If I told you to go kill yourself, would it plant an idea for you to go kill yourself?
Yeah.
I don't know where that comes from either. That is just, I think it's fear-based. If we don't talk about it, it won't happen.
Depression in teens always looks like sadness.
Depression in nobody looks like sadness, but especially in teens. Teens have what is called atypical depression, where they don't look sad, but we have to look at their other symptoms.
Teens today are more sensitive than we were growing up.
I think every age says that. We all think, oh, when I was a teenager, I was, a solid rock. That is not true. Teens are as sensitive as they've ever been.
And then, another question. This is a question: ADHD versus ADD. Now, you have some updates for us on this.
Yes, the latest diagnostic and statistical manual actually got rid of the ADD diagnosis. Historically, ADD stood for attention deficit disorder, and ADHD is attention deficit and hyperactivity disorder. They got rid of the ADD. Remember when I talked about some, especially girls, just being daydreamers? They don't have the hyperactive part, they only have the attention deficit part.
Mhm.
And the DSM got rid of the ADD diagnosis, but now we can say ADHD primarily inattentive
Mhm.
versus ADHD primarily hyperactive
Got it.
or combined.
I remember my question now. Here's my question.
hmm
I was listening to, I think, another podcast, and then I read an article on it. My daughter the other day spent 11 hours on her screen, and I lost it like yesterday on the way home from a soccer game. And I was reading about it, and what this psychiatrist had written is he had said that we are training with the screen time inattentive brains that are just constantly interrupted. And so kids are getting used to interruptions. And so they just don't have that attention because they're interrupted every minute. Like videos last a minute, boom, next video. Got to pay attention to that, another minute, last a minute, next video. And the thought was perhaps this is contributing to ADHD. What do you think?
I'm of two minds about this. I don't think enough studies have been done over this. So, do you mind if I share both sides of the coin?
Please, let's do
Yes.
it.
First, I agree. It is bizarre to me when I look at my daughters and sometimes they have two screens. Have you noticed that? There's like YouTube playing on this one and then like
Yeah.
a movie, and then they're doing their homework. And my gosh, if that's not ADHD, I don't know what is. So I really do think we are training these children's brains to be all over the place. The flip side of the coin is maybe that's where we're headed. Like, screens are part of our lives. Have you noticed how much time you spend on a screen? Heaven knows I've noticed I'm constantly on a screen. I don't even read books anymore. I read them on Kindle, you know? So this is where I'm divided is who am I to say that this is not the wave of the future? I just don't know. My gut reaction to your daughter being on the screen for 11 hours is I would have lost it too.
Yeah.
I think it is our job as parents, and heaven knows it's a hard job. I'm glad my daughters are older because I don't know how parents can do it. We got to limit the screen time. We have got to limit the screen time. If when they're 18, they want to spend 20 hours a day on the screen and go to sleep with the screen on, okay, they're adults, they're making their own decisions. But while you have the option, by all means, come up with a daily limit and stick to it.
My daughter said to me the other day, like after I said to her, like, you're on the screen for all these hours, she looks me straight in the face and she's like, you were filming all day last week. You were literally on the screen. What are you talking about? Like, how could you tell me to not be on the screen? Right. And I was just like, that's different. Like, I felt like a 12-year-old. I was like, wait a second. That's work. Like, what are you talking about?
I have an answer to that.
Yes.
Yeah, you say that is very true. Good observation. And when you're my age, you will be able to make that choice for yourself too. These are the choices I make as an adult. And it is my job to make sure that when you're my age, you will be able to make these choices too. As of right now, I'm the adult in your life, and it's my job to make those decisions for you.
I got a question for you.
Mhm.
And this is completely off
script.
script. This is an off script question. This is a parenting type of question. I think I got you here. I just want to hear your opinion on this. So I was listening to somebody else talking about their relationship with their child and
Mhm.
how ultimately you want your child to be a positive member of society and to be successful, which may require you pushing your child through difficult times, pushing them. Do you risk your relationship with your child knowing that if you push them through something, they're going to be successful on the other end if you push them through it? But they might hate you for it, but you know that they're going to be successful? Or do you try to preserve that relationship with your child and just say, you know what, this is just her. I'm just going to let her do whatever she wants and go on?
I wish there was an easy answer to that. Every child is different, and you have to decide based on the child. I myself am a relationship person, so I did not risk my relationship with my children. And at this end of the spectrum, I'm happy I did not risk my relationship with children. Do I wish I had pushed them harder? Sometimes I do. Sometimes I do. So it's a hard question to answer. One answer is if you push your children lovingly, they will not hate you. So if you are guilt tripping them, making them feel inadequate, telling them they're losers, telling them they're not working hard enough, then yes, you're risking your relationship. Nothing is worth making your child feel bad about themselves. But if you're saying, honey, you committed to soccer practice for a year. We talked about this. It is my job to drag your butt to soccer practice 3 times a week or whatever we agreed to. And you don't get to do X, Y, and Z unless you go to soccer and you do it lovingly and you drag them to soccer, then more power to you. You're doing your job as a parent.
So I feel like every parent probably goes through this, what we're talking about right now. And I guess my question is as that teen brain is developing, are there differences in what's going on in terms of neurotransmitters, which part of the brain is developing first, second, third? Is that a thing during adolescence? I think it is.
Absolutely. Absolutely, it's a thing. And I always have this conversation with parents when they say, I just told him this. I told him this 12 times. Why doesn't he get it? And I say, well, first of all, if you've told him 3 times and he didn't get it, it's not working.
Yeah.
And what happens with us as human beings, we go through a mini evolution as we go from being a child to a fully grown adult, where our brain starts developing in the fetus from the base, and think of it as developing up and out. Okay, so this part of the brain, the prefrontal cortex and the cortex, are the last parts of the brain that develop, and these are for higher functioning and for reasoning and for inhibition. Okay, what is inhibition? That thing we have where we have an impulse to do something, but this part of the brain says, that's not a good idea. Let's not do that. The kids, teenagers, don't have that part of the brain yet. So when they do something impulsive and we go, what were you thinking? The answer is they weren't. That part of the brain is not there yet. Be patient with your children. They're going to do impulsive things because the emotional center, the amygdala, is developed. So they have all these emotions, like you said. They're being totally dramatic. But heaven knows that part of the brain that says, stop. This is not a good idea. What we're doing right now is not a good idea. That part of the brain is not there yet. So you've got to be patient with your children. Understand that they were doing their best. They're just not there yet completely. And until we're 25, the brain is still developing. So do you remember, did you do dumb things when you were 21, 22? Heaven knows I did. Exactly. So that's the reason why the brain was still developing. So be patient with your children. And talking reason is not going to work. You know what is going to work?
What's that?
Consequences. Children are very, very self-centered. It is our job to be self-centered in our teenage years. The world revolves around us. So I'll give you an example. My 13-year-old was being really mean to my 7-year-old. And I kept talking reason to her. And she argued with me. She said, this is not mean. This is not mean. She was holding the power on deciding what is and isn't mean. So finally I said, next time I catch you being mean to your sister, some consequence will happen. And I don't even remember the consequence. But my kids know when I say a consequence will happen, I mean it. So I said, a consequence will happen the next time you're mean to your sister, and you don't get to decide whether or not that was mean. I get to decide. Guess how many times she had to face that consequence? Guess.
Once?
0. She knew she was being mean. Once there was a consequence, a threat of a consequence, it never happened again.
Huh. I'll have to
Yeah.
try that. So what are your 3 pieces of advice for parents in teenagers who may or may not have ADHD, or for parents that are raising teenagers with a developing brain?
First and foremost, patience. Patience, patience, patience. 2, I cannot overstress communication. Your kids need to know that they can come to you when there's a problem. And if you have made it about you, like whatever, they came and said, Dad, I need to talk to you about something. And you said something like, oh, well, this stresses me out. Then you've made it about you. They're going to want to protect you and they won't talk to you again. So you need to create a place where your kids can come and talk to you. And the third is non-judgment. Whatever it is that your kids are doing, you don't want to judge them so that they think that they disappointed you, or that you don't like them all of a sudden. You got to make space for them to be who they are without judging them. And that way, kids are going to have challenges. You cannot protect your children from challenges. I always tell parents, you cannot raise a child without trauma. They will have trauma in their lives. No matter what you do, they will have trauma in their lives. The grandparents die, they move, whatever. There is trauma. All of these things are trauma. But they need to know that you are there. Patience, communication, non-judgment.
When you think about your practice, are there 3 strategies that you employ in your practice, or are they the same strategy?
Pretty much the same strategies.
As you guys have heard, we talked a lot about parenting, but we also talked about ADHD, and we talked about mechanism and strategies to deal with it pharmacologically and non-pharmacologically. If there's anything that Dr. B stresses, it sounds like to me, it's listen to your children. And if you think that there's something that is going on from a mental health standpoint, to seek treatment and to seek evaluation right away.
And talk to people. Talk to teachers. Talk to your doctor, to your pediatrician. Talk. Yes.
We always like to end on a positive pulse. We talked about this earlier. So I want to know from you, are there any examples of you doing what was asked of you and a child flying?
Oh my goodness. So many. I'll tell you about a girl who, I think she was 15 when she was brought to me, either 14 or 15. And they brought her to me for a one-time consult of ADHD. They just wanted to know if this child had ADHD or not. She walks through the door with me, with her mom. And this is one of my favorite moms. She's so attuned to her child. The child, before she hits my couch, I go, "You're depressed, aren't you?" And she starts crying. So, but mom was present. Mom was surprised for reasons, probably the child was protecting mom and had not talked about her feelings. I got the child treated for depression first. Turned out she had significant ADHD, probably uncaught until she was in her teens, which had led to depression. You get her treated for depression, you get her treated for ADHD, lots of therapy. This kid is now 18, in college, holding a job, driving. She has her dreams. She wants to drive her. She's saving up money to drive around the country. She wants to buy a car to drive around the country. I could not be more proud of her.
That's an amazing story.
It is.
Where can we find you, Dr. B?
I am in Costa Mesa. I have you can go to drbeheshti.com or beheshtiwellness.com to find my website. I'm on Instagram and my handle is Conscious Feminism.
Tell me about Conscious Feminism.
I have been writing. I was born and raised in Iran through a revolution and a war. And then I came here in my teenage years. And so I have been witness to treatment of women throughout my life and like oppression of women. And over time, I've realized that it's not an oppression of women, it's oppression of the feminine in men and women. It's very archetypal. And so I'm starting to realize that the goal of ending human suffering would be one way of ending human suffering would be to restore balance between the feminine and the masculine in every human being. And I call that conscious feminism.
That's nice. Your Instagram, what was your Instagram handle?
It's conscious_feminism.
Conscious feminism. Listen, we really appreciate you guys listening to the Health Exchange podcast. I want to thank all of you for watching. Appreciate Dr. Beheshti coming on today.
Thank you for having me.
We're on Instagram at the Health Exchange podcast. Get us wherever you get your podcasts every Thursday morning, 6 a.m. Eastern, 9 a.m. Pacific. Appreciate all of you. Thanks again.
Thank you. Thank you.